Hello, 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 health champions. Good evening, greetings to you. I hope all is well. Well, I am coming on to wish you Happy New Year. I'm also coming on the 2nd of January just to speak about some things that are dear to my heart. And I feel that it's my responsibility to share this information, which as many as can hear this information about how we need to be stewards of our health. What am I talking about? I'm talking about being very smart about the health insurance that we select. Health insurance in the United States can be very, very confusing, and unfortunately is one of the few things that can make you go bankrupt. We know we say health is wealth, and that is correct, but it can make you go broke if you're not well informed. So I want to share my experience. Hopefully that might help you be more informed. So in case you're seeing me for the first time, you don't know who I am Dr. Dolapo Babalola. I go by Dr. Babs. I am a triple board certified family physician, also obesity and lifestyle. I'm also the founder of Living at Your Finest Wellness, which is a membership-based holistic direct primary care practice. So, in July, I opened up my own practice and I left the traditional practice of over 15 years. There, I had health insurance. And again, because it was a larger organization, they were able to afford to provide health insurance. All we had to do as employees was pay some money, but because it was coming out of our paycheck, it really wasn't that impactful, at least in my experience. But since I opened the direct primary care practice, I really understood how much things actually cost and how things are inflated because of insurance, which is rather unfortunate because it just makes it so limited to people wanting to care about themselves. So even if you want to care about yourself, just because you're so afraid of how much your insurance is going to be, whether it's your deductible, whether it's your premium, all those things are so confusing that some people just don't go to the doctor. They wait to the very last minute and they go to the urgent care or to the emergency room. Unfortunately, for some people, that is already far gone. Most of what they're going for could have been prevented, and now it's at a worsened state. Well, for me, my birthday was in December, and I do my best to go for my annual physical. Because I already had insurance that my husband had gotten for the family since I left my past job, I didn't have insurance coverage. We were informed that basic labs were going to be covered. So preventative labs, I wanted to do, I always say test, don't guess. I wanted to do A1C. I really wanted to make sure I was not anemic, check my electrolytes, check my thyroid, look at my lipids. I wanted to check my vitamin D because I had been low in the past. I was told it was going to be covered by insurance. Now, imagine my shock when I got a bill for labs of over 1,000. Now, I did get some additional labs because I told my primary care doctor that I was a little bit concerned, even though in my family we have a genetic predisposition to alopecia. I wanted to make sure that it wasn't anything extraordinary. I'm doing my best to live at my finest, health and well-being. And so they did some additional tests. But regardless of the additional tests, there's no reason why it should come up to over 1,000. Let me show you what those basic tests will cost in my own practice, the direct primary care practice. So this is what that would look like in my own practice. Can you see that? That's what it will look like in my own practice. Look at what it looks like here. CBC is what we're looking at to see if there's anemia. That costs about $5. Comprehensive metabolic panel. You see what it looks for, electrolytes and kidneys. It costs about $5 as well. Look at what it costs average if you were paying out of pocket and sometimes with insurance. So look at this. A whole bunch of blood work comes up to about $40. Now take a look at what the bill, which I'm holding in my hands, a printed copy. I could not believe they even put me on a payment plan. This is LabCorp telling me that my insurance did not cover it. Meanwhile, my insurance said they were going to cover my labs, right? These are preventative labs. They just don't even care about preventative. They want you to be sick first before they cover anything. I mean, how does that make any sense? We know that a cure. When you're in the preventative stage, you save a whole lot of money, right? I'm trying to remember the adage that says a cure in time saves many. Prevention is better than cure is also another adage. But anyway, look at this blood work. Same CBC that you saw that mine was about $5, theirs is 32. Comprehensive metabolic panel, 48. Why? It's the same blood test. It's run the same way. For direct primary care practice, with or without insurance, you are entitled to know about your health, to know about your health status, your metabolic panel, so that you can show up and be ready to work on those parameters. Look at what the numbers came back as. A vitamin D, 200, is that 200? 245. I mean, unbelievable. And they put me on a payment plan. They said, "Oh, we know you're going through hard. We might be going through hard times, so put me on a payment plan." And I called my insurance broker. I was like, "Why do I have such a high bill? You said you were going to cover it." They said, "Well, insurance, the practice inflated the price, and then I should call them and tell them I don't have insurance." Do you believe that? I mean, does that make any sense? It is so unfair. It breaks my heart that people have to go through this. And this is me as a physician to going through all of this. How much more people that are not physicians? Well, that's why I wanted to share with you today that the solution to all this expensive healthcare, insurance, even though insurance does have its place, we need to know that health insurance really is more for the 10% of the catastrophic things. So God forbid, you need a hospitalization, you need a surgery, or you need a specialist. That is what health insurance is really for. While 90% of your healthcare needs should be covered by direct primary care physician. And I want to share this with you so that you see what I'm talking about. This is what a direct primary care physician, comparing it to traditional, a direct primary care physician is the new way of introducing healthcare that prioritizes the patient, that thinks about the patient, that is cost effective, that is compassionate, that is comprehensive, that it coordinates care, all those things. As for me, it makes me feel like I should have just drawn my own blood and paid just $40 instead of having to go through all of this. But if we're already paying a high premium, I get it. Who wants to pay a high premium already and pay double? So there's all that back and forth. But let's take a look at direct primary care, the difference between that and primary care, just in case you're stumbling upon direct primary care and what it really means. We cut out the middleman, chop, 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 which is an insurance company. So it's the Netflix of medicine, right? The Netflix of medicine. So you have access to your doctor. They know you as an individual. They have fewer numbers of patients. We usually cap at 600 compared to the traditional world where I capped at over 3,000 patients. With a direct primary care, they have discounted labs, discounted medication, discounted imaging because the middleman insurance is chopped off. Other things with direct primary care and how it's different from traditional primary care is your appointments are not long. Today, I signed up a member that was interested in practice, and she said, "I hope this is not the kind of practice I'm going to have to wait 3 months before I get an appointment, because this is immediate. This care we need is immediate." And I said, "Not at all. No, 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 no. As soon as you turn in your form, which is simple and basic, as a lifestyle physician, I want to go over your health assessments, figure out what's going on with those lifestyle habits so that we can come up with a customized, personalized plan for you. We get you in." So I already scheduled the appointment. Oh, same day, next day appointments are available. No copay. Can you get that? Regardless of how many times you see your doctor in the direct primary care model, you are not needing to pay a copay. Copays range from, used to be 15, now I hear the lowest is about 35, 45. It can range all the way to 75. You're paying that copay. It's if you don't pay that money, you don't get to see the doctor. So that's what's called a copay, right? Price transparency. I mean, look at this. Entering into the new year with this bill was not pleasing at all, and that was why I was compelled to come here and share that none of us are exempted from this insurance. In my own opinion, it's just fraudulent. Why should this happen? Now, Near cost, of course, for anything that we talk about. Same doctor, you're not shifting from one doctor to the other. I remember trying to get my son in to see the doctor. His birthday was in August, and we couldn't, because of all the things that were going on, we couldn't get him in. And I forgot to call. I was just busy. And so by October, his regular doctor, she was booked all the way till next year. And I wanted him to be seen. So I said, just give me whoever is available. And that's what they will do. Right. So these are the things that differentiate a traditional primary care from a direct primary care practice. My practice called Living at Your Finest Wellness, where we provide personalized, compassionate, excellent, holistic healthcare, whole person for you so that you feel that your needs have been met. And we do it in a cost-effective way. I want to share also that some people tend to ask, well, okay, do I still need insurance? Yeah, as I mentioned, direct primary care will only take care of 90% of your primary care health needs. For instance, these are some of the things that I will take care of: acute chronic health care needs, minor office procedures, women health, so pap smear, contraception, birth control, all of that. Also lifestyle medicine management, obesity medicine management, preventative service, screening, all physicals, mental health, all of that is covered. And then, of course, in-body scan. I do also offer non-member services, like a one-off. I do offer that. Now, why I'm sharing this is I want you to realize that there are options, just in case you're hearing this and you're like, oh my goodness, I don't have the money to pay for insurance, a high premium, but I still want to get checked. I still want to make sure I'm okay. That is the smart thing to do. You want to look for a direct primary care doctor in your location. Wherever you are, there are direct primary care doctors all over the United States. So you would just go to DPC Mapper. They are Frontier. I'll put that link in the comments. You just type in your location, and of course, most of them will do a meet and greet so that you get to see if they align with your own mission and vision and what you want to see for you and your family. But there are options. Now, that's 90% of your healthcare needs. The remaining 10%, this is where we say Sedera. Sedera is a health share, and it's not insurance. There are other health shares. Sedera is one, Clearwater is another, Zion is another. So there are a few out there. And for direct primary care, most of us will pair up because we care about your well-being. We care about that 10%. We care about you being cost effective. So we will pair you with a Sedera health share representative that they will dive into your own specific needs and provide informed information about what best suits you, instead of just going through that that paper thing that the insurance people do and just call up a number for you. There's no middleman, so there's nobody trying to siphon all your money out of your pocket. So that's what I wanted to share with you today. I hope that this has been helpful, that from my experience, that you will not just leave it to guesswork. You would actually be empowered to go out and ask the questions, look for direct primary care. That is, if that is of interest to you. If you're interested in longer visits with your doctor, personalized visits with your doctor, reduced wait time, no wait time, if you are interested in any of those, then direct primary care is your option, your best option. If you're also interested in reducing your costs and not being like me, that I went to my doctor, even though with insurance, now I have to call them and tell them I don't have insurance, and then we'll see. I mean, I definitely have to follow up with you and let you know what the bill ended up coming up to. So I just wanted to share that with you. But once again, Happy New Year. I wish you all the best in this year. The goal is for us to live at our finest well-being by being whole, vibrant, and healthy. And the way we can do that is making sure that we optimize our metabolic health. Do not say, I feel good, I don't feel pain. The body is very forgiving. You still want to get checked at least once a year to confirm, right? Not guess, but test. And you want to do it in a cost-effective way. You do not want to procure a bill of over $1,000 for the same labs that you can get done at the direct primary care that will cost you some places $2 or even more. So I hope that this was helpful. If it has been, please leave a comment, share with friends and neighbors that might find this valuable. The whole idea is for us to live at our finest because we are all worth it. So take care and God bless.